And I must say that when I started doing research, I was at McGill University, and I started there in 1987, and started working with a doctor who basically at that time evaluated all the perinatal deaths, and they had a 98,000 women, and they had evaluated all the losses for over 30 years. And so for me, I had the opportunity of like doing 2x2 tables and trying to look at risk factors. And then I came to the Harvard School of Public Health, so I could do a master's in the School of Public Health and to get epidemiology experience. And that's where I had a paper that came out, and it was really interesting because the parent group sought me out. And it was through Frederick Frohn and Deborah Boyd and Laura Reno, and we said, well, we need real information. So out of that evolved, really, we in the stillbirth community have not been we haven't had the same attention as those babies who have been lost in the first year of life. And so, and it's 10 times more common. So how are we going to say, well, we need to study this? And it was really the parents, and I gotta tell you, the parents have made a huge difference. Because I feel like we've made little progresses, but it's only with the role of parents that have sort of raised awareness. So I think this is a picture that was from Japan in 2006. And if I have my little pointer here, these are two new stillbirth moms who went all the way to Japan to say, wow, what happened? No one knew, and so they had gone on an internet website, and this is a woman from the WHO. This is JJ, a researcher from the Netherlands. We have other people from the United Kingdom, a combination of stillbirth parents. This is Uma Reddy, who I presented with in ACOG just last week. I get to be in the front, but here we are. This is the first time I put this little joy picture. I felt like jumping for joy. We finally got in. So this was our first time we've been invited to give any information on stillbirth at the ACOG meeting. It is basically the elephant in the room. Everyone wants to prevent it, but no one wants to talk about it. And so Uma is from the NIH, and she's just really a hot ticket. She's very science oriented, and I am too, but I also feel the passion of the parents. So I always make sure her slides are more interesting because they get a little dull. Anyway, so there was a 3-hour course, that was ours. They also had a new session on bereavement, and they had a lunch and learn. So the very first time that we're finally educating our providers. Because what's interesting at these stillbirth meetings is 1/3 of the people are parents, the rest are researchers, and where are the providers? They're not there. So we're getting in. It wasn't the best attended, but like I said, I think we got great reviews, so hopefully they'll have us again another time. And this is a picture I got from Chris Wildsmith, who's a stillbirth parent, and he said, what? How come no one ever told us it could ever happen? Are you kidding? It's the highest contributor of perinatal mortality, and no one talked about it? Like, there are people looking through the books, and they're thinking, all the what to expect, and it's not in there. So anyway, I was really pleased with this product because I think it combined the empowerment, the kick counts, and also new data on sleep and the importance of sleep. And so I'm going to share with you a little bit of the, that was just both sides. The first habit, obviously, the basics, making sure that you have healthy habits. Exercise is good, actually. People sometimes, if they've been through fertility treatments, they stop exercising altogether. And you really want to promote, even just, using common sense, and being mindful of movements, and then, if diagnosed, don't be afraid of asking questions. So I think it's a great message. And I really do think that fetal movement remains a very important message. And I did, well, I'll just read this study. It's gonna make me cry. So anyway, 43-year-old IVF pregnant woman presents at 40 weeks and 4 7 days with decreased fetal movement for 2 days. And she's advised that the baby has less room to move and to drink some cold water, and if she's still concerned, to make her way to the hospital. So she was basically given a non-stress test where they put a little monitor over the heart, over her belly, and the heart rate looks fine, and she's sent home without really thinking about it, you know. And then she's seen 2 days later, and the same thing happens. But it's a Friday, so they said, well, why don't we induce you on the Monday? So, but then she comes back later that night, and the baby has died. And that was her last chance at having a baby, and it has been a devastating outcome for this couple. So basically the problem is when people present with decreased fetal movement into any labor unit, it's like a roll of the dice. If you happen to believe it's important, then you're going to get more care, and if you happen to get a provider who doesn't think it's important, then you're going to have an NST and sent home. And so it's really a missed opportunity to review all of the information and to say, okay, this is a risk factor. I really have to think about, you know, is this a true alarm, or is it, you know, just the baby was sleeping? It's an opportunity to evaluate. So the problem with fetal movement and why it came out of favor is this old study here, which said, okay, we're going to randomize you guys to do kick counting over here, and you guys are in a study about kick counting, but you're not going to count. So, I mean, how does that work? Well, what was interesting was that during the study, the stillbirth rate was 2.8 in both arms, which was the lowest. It's lower than here, in women who were 28 weeks or more. So before the study, it was 4.0, and so they decided kick counting wasn't useful. But so really. So that's an old study, and then kick counting became out of favor, and yet here you are, you have just knowledge and vigilance decreased it significantly. So this is a slide I got from Alex Hazel. He's a UK researcher. I like this, so I want to give him credit for this. So he uses some lingo, but he says the problem is reduced fetal movement, they call it, is like a symptom. It has to be evaluated, just like any other symptom. If you had chest pain, you know, you'd call 999 or 911 here, you would go to the doctor, you would have an EKG, you would have a test, and if it was warranted, you'd have an angiogram, and then of those, maybe only 4% down here are going to actually be diagnosed with an MI. So really, instead of just saying, you know, decreased fetal movement, NST out the room, treat it as a risk factor that needs to be evaluated. So I did this practical quality improvement, and it was basically following up patients with decreased fetal movement, looking at providers and patients' outcomes. I'm going to not belabor, but so the providers' responses were pretty good. About 50% of the patients that when they called, they said, oh, my baby's not moving, were brought in to be evaluated within 1 hour. I thought that was pretty good. 7% were admitted for observation or induction, 6% of the babies were admitted to neonatal intensive care. And over the course of my study, the ultrasound rate went from 11 to 18%. What was sad was that if you look at this lower number, 50% waited more than 2 to 17 days before calling their providers. So that's really a missed opportunity. 19% waited a day, and then some waited less than a day. And the overall risk for their subsequent stillbirth was 4-fold higher. So it is a true risk factor. Frederick Frohn, who was one of my colleagues, did a before and after design, just saying, okay, why don't we try to educate people, and we're not going to randomize them, we're going to say before and after. And really the knowledge was, okay, we're going to have guidelines, and we're going to teach people about the importance of fetal movement. And so they had 19,000 before and 46,000 after. They had 14 hospitals, and within the guidelines was an ultrasound, which was routine there. And so before the study, the risk of the complaint of decreased fetal movement was 6.3 and 6.6, which was not significantly different. So people thought everyone was going to come flooding in. The thing that's also good to know is that being mindful of fetal movement is actually reassuring. It doesn't cause anxiety. People thought, oh, you're going to make everyone anxious. People still waited, but this was statistically reduced. The use of ultrasound went up from 86 to 94. Now remember, we don't do that here. We're in the 20s. And the stillbirth rate from 28 weeks or more went from 3 per thousand, let's go back, 3 per thousand to 2.0. And when we were at this ACOG meeting, one of the participants said, don't we have a lower stillbirth rate than the United States? And Uma Reddy and I said at exactly the same time, yes. So this guideline would make a difference. So anyway, what was interesting is when you look at what are the tests, the NST is the first test that's done, and it was abnormal in 3.2% of the evaluations. But the ultrasound showed more abnormalities. So we're really missing that opportunity, and the most common missed opportunity is the baby that's too small, that might be at risk, and now has to be followed because it's too small. So what's interesting is that people say, well, oh, it's normal for the baby to slow down in the end of pregnancy. No, it isn't. What happens is that the sleep-wake cycle gets longer. So the baby sleeps for longer, and it's awake for longer. And while there's less like true kicks, like, you know, there's more wiggling, whatever. So if you were to count when the baby starts being awake, and you counted all these wiggles, then on average it takes about 10 minutes to get 10 fetal movements. If you start counting when the baby's asleep, it could take up to 2 hours. So the most efficient way is to do it once the baby starts moving. And these are normal pregnancies, okay, so without any risk factors whatsoever. So this is what we're going to say is normal. And you're going to compare it with other pregnancies. So smoking, for instance, the risk actually went up, or the time it took to get 10 fetal movements went up, so that there was the alarm limit of 2 hours or more occurred in 9.1% of pregnancies. And of course, these women are at risk for increased risk of late stillbirth. And these are only including live births. Women who are overweight, they feel less movement throughout the